yesterday, the Chief Minister Uddhav Thackeray has warned that there could be another lockdown across the state if COVID numbers keep going up. He said there would be clarity on this in 8 to 15 days and asked people to follow the COVID protocols and wear masks. Meanwhile, there are already restrictions in some parts of the state. In Amravati, for example, there's already a lockdown in place till the 1st of March. Let's go across to NDTV Sohit for more on this. Sohit, in Pune as well, restrictions have been put in place and also restrictions in the state on large gatherings.
Well, that's right, Gargi. Yesterday, in fact, Chief Minister Uddhav Thackeray has said that until further notice, there will be no political, social or, religious programs that would be happening where there will be huge numbers of people that will be attending them. Apart from that, he has given, powers to different district collectors to ensure that the number of cases in their districts come down. So yesterday, while Chief Minister was speaking, he said that around 10 to 15 days ago, there were around 2 to 2,500 cases that were reported in the state. But now the figures have gone up to 7,000 cases per day. So if I tell you the information of the last 24 hours, there has been 6,971 cases reported in Maharashtra and 35 people have died in the last 24 hours. So after which Chief Minister yesterday spoke and he also gave a warning that if people don't follow all the precautionary measures, then he will be forced to announce lockdown in the state. However, there have been lockdown announced as well as several precautions are being taken at different level. For example, if we speak about Amravati, a 7-day lockdown has been announced over there. In the last 24 hours in Amravati, there has been 926 cases reported, after which there will be a week lockdown that will begin at 8 p.m. today and it will go up till 28th of February 8 p.m. Only essential services will be allowed at that time to operate. If we speak about Akola, there is lockdown that has been announced in several parts of Akola, which includes Akola city, Murtizapur city as well as Akot. And over here the lockdown will be from 23rd of February till 1st of March. Several such new guidelines have been given, first by BMC on Thursday and now by the Pune Municipal Corporation as well as the Pune district officials. Even in Pune, the schools and colleges will be shut till 28th of February. The hotels, restaurants and bars will now be able to be open only till 11 p.m. Earlier they used to be open till 1 to 1:30 a.m. in the morning. Apart from that, the marshals across the state has been increased. The government is also trying to ensure that people follow these rules properly, and if they don't, they are being fined. In fact, BMC on 20th of Feb, only in one day they have collected more than 32 lakh rupees in fines. The maximum fine is 200 rupees. So you can understand that the big number of operations that is being taken on. Chief Minister also said that now the cases 15 days ago, the cases were around 2 to 2,500, which has now increased up to 7,000. So if this is a second wave, he said that we don't know yet if this is the second wave or not, but in the next 8 to 15 days, we will know about this. And if the cases increase and people don't follow all the precautions that have been asked by the government to follow, then he'll be forced to announce lockdown across the state.
All right. Thanks so much, Sohit, for joining us with those details. And Maharashtra remains the big worry as cases are rising there again and the possibility of another lockdown throughout the state. Well, to talk more about the COVID situation, we're joined by Dr. Padmanabha Shenoy, rheumatologist and immunologist from Kochi. And we'll also be joined by Dr. Muzaffar Lakrawala, advisor to the BMC on COVID. He'll be joining us shortly. But first to you, Dr. Shenoy, a very worrying situation. And now, of course, the centre talking about the rising cases in 5 states and union territories, etc. But in Kerala, there's been, we've been seeing the cases going up there steadily. What's the situation like right now, and what steps is the government taking?
No, Kerala is a different story when compared to Maharashtra and Andhra. Kerala is a different story because of the Kerala was rising, and now for last couple of weeks, curve is slightly down. Kerala used to report 7,000, 6,000 cases over past 4 or 5 days. For past 14-15 days, number of cases per day is around 4,000, 5,000. Test positivity, which was about 10, has slightly come down to 6, and now it is plateau for last 15 to 16 days. So Kerala is definitely, but Kerala never came down like other states came, because Maharashtra all came down to 2,000, 1,500 cases. Why Kerala is not dipping is, first and foremost, we know zero prevalence in Kerala. That means how many people are immune to this COVID virus is only 10% in most part of the Kerala, even in towns and urban areas. while in Maharashtra and parts of Delhi it is 50%, 60%, or most of the part of the country it is 30%. So Kerala, there are susceptibles are more. That is the first and foremost reason why Kerala is not dipping. And second is Kerala is much more urbanized than many other parts of the India. Like Kerala is like a big metro, big city. After one city, next city begins. And travel between places is very high. Population density is very high. And third most important factor which we need to watch is whether there is a mutation already has happened in Kerala. Already there are some reports coming out from CCMB and other organizations, IGIB, that there is almost 10% of the viruses are immune escape mutants in Kerala. But the study is very, very limited. What is India is lacking? Like when we started in last March, PCR tests were very scarce. Then we ramped up the capacity that we could do 5 lakh, 6 lakh PCR tests per day. Similarly, need of the hour is to do genetic mapping of virus. Especially in Maharashtra, we are seeing after dipping, there is a rapid increase in cases. So is it because of the easing of the COVID restrictions, or is it because the virus strain has changed?
Definitely, I think because of easing of the restrictions to some extent must be there, given that, the local trains. Yes, Kerala, a few weeks ago, it remained the big worry with cases going up. Now, other states have suddenly seen this spurt in the number of cases. This worry about the mutant strain as well, Dr. Shenoy, are there reports of it in Kerala? The centre has asked all the states to check for the variants as well, because we do know the crisis in Europe right now, in UK and the US, has been caused largely because of these strains that are said to be more infectious.
Yeah, very true. Gargi, the problem is we are not studying it. That's the point I'm trying to make. We are just studying less than 1% of the total virus strain and trying to make, for example, if somebody, we are studying those people who are coming from Britain and seeing whether they are carrying the virus.
Yes.
But that is not the need of the hour. What we should do is, if you are diagnosing 100 cases in a city, out of those 5 people has to be randomly picked and genetic sequencing has to be done. And we need to see whether they are behaving differently. In UK is doing 10 to 15% of their samples on a daily basis. We don't have such a surveillance system, and I think that is the need of the hour. And second thing is, whatever may be the mutant virus, the good thing is if we have mask and we are in an open space, we don't enter closed space, definitely
right.
We are safe.
Right, and that's the point that the Chief Minister of Maharashtra made yesterday, that please follow the mask rules, and otherwise you'll be facing another lockdown. We have with us Dr. Mufassal Lakrawala. Thank you so much, Doctor, for joining us. A very worrying situation in Maharashtra. I was just speaking to Dr. Shenoy about how, in Kerala earlier the cases were rising, but now they seem to have steadied somewhat and the positivity rate has come down somewhat. But now in Maharashtra, big worry, restrictions are already in place in some areas, and also no big gatherings have been allowed.
Yes, I think what the Chief Minister said yesterday was very, very correct. It is a huge worrying sign. He said that in Amravati, 1,000 cases per day was at its peak, and today it's just 1,000 cases a day. And that's why they've had to shut down the place. The thing is that people have forgotten the very basics of how corona was prevented right in the beginning. Nobody is using social distancing. People have let go of their masks. This false sense of bravado has cost us very dear. And that's where the Chief Minister is coming, that don't compel us to shut places down. It's a kind of request with a stern warning attached to it, that please, please don't allow us to go back to the dark old days of corona when we were really struggling. Economy was hit. Now it's a envious task to be the Chief Minister of a state which has got the largest numbers, because on one hand, he has to handle the economy, he has to open up the cities and the places. At the same time, he has to convince people to keep putting up those precautions when they're out in public, which people have let go.
Right, and therefore extraneous things like, social gatherings, religious gatherings, political gatherings, he said not to go ahead with that. But Doctor, also the worry about the variants, what do we know so far about, how prevalent or the variants may be in the state?
The problem is that Maharashtra was one of the first people to lock down its borders, whether people were coming from the UK, people coming from Brazil right now, from UAE. Unfortunately, people are taking the other route. People are coming from different cities of India, wherein there is no kind of regulation on how they come in. And so it's a sad state that people feel that they can circumvent the rules by using a loophole in the system and actually putting not only the family members at risk, but also all those healthcare workers who've sacrificed so many years, at least months of their life, leaving their loved ones at home, and then increasing the numbers. I think that people have to be responsible first. People should not try and circumvent the rules. If they're coming from UAE, UK, wherever, Brazil, for example, they should stick to the compulsory quarantine of 7 days institutional, get tested twice and then come out, because it's going to be impossible. There's so many mutants. We do know that every virus does mutate. Now, which virus is more infective? Like the head of AIMS, Dr. Guleria, did say that maybe these might be more infectious. We do not know. So it's impossible to keep testing various strains. We do know that the South Africa strain is not even as effective to the vaccine. Another thing that people have let go is they believe that the vaccine has come in, so they let go of all precautions. Now, people must understand that it might take them at least 3 months, even after the vaccine shots, before they might be resistant to this virus. So please don't let go of your precautions until then.
All right, and all the hard work that has been put in by the medical fraternity go to waste. Thank you so much, Dr. Lakrawala and Dr. Shenoy, for joining us on the show this morning.